PSI was founded by asking bold questions. How can we do development differently, more effectively, and with greater dignity for the people we serve? We started by trying to help women and couples in developing countries plan for the families they desire by providing education and access to contraception. What made us different is instead of giving away family planning products at public health clinics, which are few and often not conveniently located, we sold products at reduced prices and made them widely available. We built brands around them and marketed them so people knew the benefits of use. We used street theater, posted billboards, and started radio programs to educate people. The result was a greater level of dignity for the people we serve. They get the information they need in a way they understand. Profits from the sale go right back into more products, services, and care. It's a truly sustainable model. PSI's objective is to improve the health and rights of girls and women in the developing world. We know that when you lift girls and women, you lift families, communities, and countries out of poverty. The world is beginning to understand this. The UN released a report that states we can end extreme poverty in our lifetime if we give girls and women access to basic rights and healthcare. Many of the health solutions girls and women need already exist. They're simple, effective, and ready to go. Our work is to make sure women have access to them. To do that, we need to pilot these programs now and produce a base of evidence to unlock governmental funding. Right now, we're engaging new philanthropic champions in this effort. We need new voices and increased private investment to improve global health and bring people out of poverty. We're successful first because of our scale. PSI works in 70 countries in the developing world. I like to say we're the FedEx of global health. We bring health products like mosquito nets and services like cervical cancer screenings to millions of people in the developing world. Second, we use proven business practices. PSI has developed the world's largest network of franchised health centers, delivering services to more than 10 million people every year. The health centers are conveniently located, and they offer a one-stop shop for the most pressing health needs. A mum can come in for contraception, but also find a mosquito net, safe water solution, and can get the care she needs for her newborn. And for those in very remote areas, we employ local health workers who go to them, sometimes by foot or even on bikes. PSI is effective because we grow deep roots in the communities and countries where we work. We also have a long-term commitment to the people we serve. We know their health challenges change and evolve, and we're there for them today and tomorrow. Our success also lies in the partnerships we build with our donors, ministries of health, local nonprofits, and corporations around the world. We have global clout, but our solutions are local. PSI has a relentless focus on measurement and evaluation of our health impact. We track our results much like a corporation measures its profits. We measure impact in years of healthy life added. We've developed an internationally accepted formula to calculate health impact from products distributed, services offered, and care provided in terms of years of healthy life added. In 2011, PSI added over 22 million years of healthy life at a cost of roughly $29 per person. Our goal is to increase the number of years of life we add while reducing the costs as we go. Many people don't know that while we have a large global network, PSI is really a collection of local organizations. We know that the best solutions come from the ground. That's why 98% of our 9,000 staff members are from the communities and countries in which we work. In addition to strengthening local communities, PSI invests in them. For every dollar invested in PSI, nearly 95 cents goes to programs that directly reach the people we serve, creating measurable health impact. PSI is a global leader in HIV prevention and family planning. We are also the world's largest distributor of long-lasting, insecticide-treated bed nets to prevent malaria. Our major accomplishment is our ongoing innovation in health delivery. We take complex problems around the delivery of healthcare and figure out how to deliver them far and wide, safely and cost-effectively. We know that small, forward-thinking investments today can have a global impact for tomorrow. The greatest challenge we see is a lack of funding for research and development. This is especially true for health interventions that can improve the lives of girls and women. We have 12 pilot projects on the shelf right now ready to be tested. The evidence they'll provide can unlock government funding and effectively change the way health is delivered to girls and women and their families. For now, this type of funding comes mainly from philanthropists, people who know the value of research and development, who know the next big idea may actually be small and simple, and who know that without trial and error, we'll never achieve a better world. We have 12 projects ready to go that address health from birth to motherhood. With additional resources, we could pilot these projects now. A great example is basic, clean delivery kits used at childbirth. In developing countries, one of the biggest health threats to women is complication during pregnancy and childbirth. Around 1,600 women die every day from these complications. When a mother dies, her children are 10 times more likely to leave school, suffer from poor health, and die prematurely. PSI's kits are a sustainable solution that will minimize the risk of infection for the mother and baby. At just $10 per kit, the return on investment is huge. Healthy mums and healthy kids can lift families and communities out of poverty, and each clean delivery kit is a step closer towards that goal. With additional funding, we could scale up health interventions like this one and bring them to even more people around the world. Although significant investment is made to overcome health challenges in the developing world, very little funding is dedicated to the integration of health services. By putting more services under one roof, PSI is able to address all the health needs of a mother and her family. This improves healthcare at the most basic level, making it easier to get the services and resources she needs. However, we still need more donors to fund the strengthening of this health system. To address this need, PSI has developed a new initiative committed to improving health systems by making them more comprehensive and cost-effective for women and their families. With this long-term perspective in mind, PSI hopes to change the way health is delivered to ensure a better system that works for everyone.